Hi, my name is Dr. Rick Franks. I'm president of Chiropractic Lifecare of America. And the title of this webinar is What You Absolutely Need to Know About Your Fee System, the do's and don'ts for taking care of your cash patients. That's the purpose of this program, is to show you what's legal and what's not legal in our practices. I want to start off by reading an article that was just recently put out in a magazine from Medicare. It says here, the Center for Medicare and Medicaid Services published a study that shows a return of $373 for each $1 spent on post-payment audits. For this kind of return on investment, both Medicare and the insurance companies have been hiring and training an army of auditors. These auditors could soon be knocking on your door to make sure that you have complied with all the new rules. If you have not, then there will be demands for big refunds from you and will include penalties and interest charges. Now, the reason I say this is because we all go to insurance seminars and we study insurance laws, and we're all trying to do the right things. And as you know, it's ever-changing. Every 3 months they're making changes. And we're trying to just stay in compliance with all the laws. Well, that's what this webinar is about. It's how to stay in compliance with your cash practice. Many of us have been taught wrong for the past 20 to 30 years through our schools, through our consultants. The purpose of this webinar is to show you what's right, how you can do it, how you can make it easy, and how you can make it legal and ethical. So let's get started. So here's the rule passed down by the Attorney General's office, and this is something that all doctors need to know, but we kind of forget, or maybe don't even know about it. So let me read this to you. Any practice that renders a medically necessary service as defined by the carrier, collects cash from the patient, but sends a bill or provides the information from which a bill is sent, not only has post-payment liability for the representations made regarding the service performed and the necessity of that service, but is in essence an insurance practice. So a lot of doctors think that just because they give the patient a super bill or whatever, they think that they're a cash patient. Anytime you give the patient information that they can turn around and bill to an insurance company, makes you liable on that insurance. You are still liable for the information regarding that insurance. Now, here's the problem that we run into as a chiropractor. Since chiropractors can't opt out of Medicare, even non-participating providers retain the obligation to bill Medicare for covered services. In other words, what it's saying here is that Medicare patients have the right to bill their Medicare insurance. As long as that's happening, then you are at least a partial insurance practice if you accept Medicare patients. So in reality, as a chiropractor, there's no such thing as a 100% cash practice. The only way that you can actually have a 100% cash practice is if you refuse to see any Medicare patients, then you wouldn't be tied to Medicare. So in actuality, we're all still tied to an insurance practice if we're seeing Medicare patients. So we have to protect ourselves. And how do we do this? Well, Stuart Hoffman, he's president of Chiropractic, one of our malpractice insurance companies in this country. He says this: all providers are facing a wave of audits by third-party payers, seeking to find some basis, however flimsy, to seek repayment for services you have provided. In other words, if you remember what I said back in the beginning, what's happening right now with this reimbursement and these post-payment audits, they are going rampant. And with a $373 for each dollar spent return, you can imagine what's going to happen in the near future. So this is what we have to do. We have to protect ourselves. This is what Dr. Hoffman says about what these auditors are doing to the doctors nowadays. They're having meetings with patients about your care without you knowing about it. They're having interviews with employees, especially your ex-employees, former employees. They're actually sending sham patients to your office trained to trip you up and find loopholes in what you're doing. And the ultimate disaster for the practitioner is a charge of outright fraud. So I want to just cover a couple of little things on all these different programs that we have. One of these programs that almost every chiropractor is on, whether it's a cash discount program or a prepay plan or a wellness plan or a case fee, the unlimited care for a fixed fee plan, the monthly plan, and the family plans. These are all basically just different ideas that chiropractors come up with to put a different name on pretty much the same kind of story. So not saying that they're illegal if they're done right, and that's what we're going to talk about right now. All right, we're just going to spend a couple minutes on all of these. The first one, cash discounts, also known as a time of service discount or a point of service discount. Here's the rule that you have to understand on this. Anytime you charge two different fees for the same service, you now, in insurance terms, have a dual fee system. And as you know, dual fees are illegal. It's as simple as that. Here's what Dr. Pete Fernandez says about cash discounts. Insurance companies learned that chiropractors charge a higher fee to insurance patients than they do to cash patients. This is against the law, it's insurance fraud, and it's the norm across the country for most chiropractors. I realize this type of fee structure has been taught by chiropractic colleges, certain consultants, and seminar givers. Regardless if it has been taught, regardless if it is widespread, it's illegal and is pure and simple insurance fraud. That kind of says right there what's going on with us and what we're taught. I mean, because we've all been brought up to believe, oh, we can do this and it's legal and it's okay. Well, this is what Dr. Pete Fernandez says about this, and he has some insight on this. Health attorney Larry Lawrence says you cannot charge X dollars for cash patients and Y dollars for insurance or PI patients, despite the fact that your overhead is higher for insurance patients. I know as well as you do that, yes, we have to pay out more money, and it costs us more to do this for insurance, and we have a right to give a discount for cash. Unfortunately, insurance companies don't feel that way. It doesn't matter to them what we think. What matters is the law, and if you're charging two different fees, it is illegal. Roger Colton, one of the nation's leading healthcare attorneys, he says this: do not set up a discounted office visit fee for your private pay or uninsured patients because it may be construed as a dual fee schedule or an act of insurance fraud. We're going to talk about fraud here in just a second. Many of you know Kathy Mills Chang. You go to her seminar. She's one of our leading gurus out there right now in the insurance business, and she's very dedicated to try to keep most of us out of, or keep all of us out of jail by trying to make sure that we get our facts right and our paperwork right. She says this: can you legally charge $75 for an adjustment for personal injury or insurance payer class and then charge $30 for a cash payer class? That answer is no. Deborah Green, she's a health attorney in New York and Florida. She says this: if you are dealing with cash only, do whatever you like. But remember, you may legally give a discount only if you give the same discount to the insurance company. What does that say? It means if you want to give a discount to a cash patient, in most states it's legally up to you to notify all insurance companies that you deal with that you give a cash discount. Now, if you start doing that, can you imagine what the insurance companies are going to say? So that's not really a way to do it either. How about prepay plans? These are very popular among chiropractors. Attorney Michael Schroeder says this: through a number of recent court decisions and a bulletin from the National Association of Insurance Commissioners, it has become clear that many of the prepay plans being offered by chiropractors are illegal. Once again, Dr. Fernandez, utilizing a prepaid plan not only is violating the non-dual fee provision of the law, but also may be guilty of violating laws that regulate HMOs. Many of you know Dr. Dennis Nicotel. I consider him the father of the cash practice. So this is what he has to say about prepay plans. The major issue behind having legal prepay cash plans seems to hinge on the question of the assumption of risk. Now, if you don't know, risk is a four-letter word, and it's used by insurance companies. Now, if your cash program has risk involved in it, it means it could be construed to mean that you are operating as an insurance company. And if you're operating or if you're providing insurance without a license, you're illegal. And that's where this fraud word comes in. So I'm telling you, this is what people are looking for. These are what the people are coming into your office, and this is what they're looking for. I'm not asking you to listen to me. I'm asking you to listen to our leaders, and every one of them are on the same page as far as all these plans go. Dr. Fernandez again says this: Believe it or not, insurance commissioners are already arresting chiropractors and prosecuting them for insurance fraud because of their prepays. Next, we have is wellness plans. And what is basically, a lot of doctors, we all know what a wellness plan is and everything, but basically what it is, it's unlimited visits in return for a fixed monthly or annual payment. Many of us do this. Many of us were taught this in school or from one of our consultants. Well, here's what health attorney Roger Calton says on this. These plans may violate state insurance and or HMO laws. Dennis Nikitow, he says this. You must stay away from unlimited care for a fixed fee, cap fees, year-long programs, or any program structured around a specific period of time. Now, that last word there, is time, is a four-letter word. I told you there were two four-letter words. This is the second four-letter word. Risk and time. Those are both insurance terms. And if your fee structure is structured around risk at any way or time, the risk being to either you or to the patient, or a time frame, then you have a problem, and it is considered not legal. As I'm saying, Dr. Nikitow, he knows probably more about cash system than anybody, and he's saying stay away from it. Next, we have case fees. Dr. Fernandez says this. First, with any fixed or capped fee, patients are not paying or might not be paying for all the adjustments they are receiving. When that happens, basically what you have is you're involving risk again, which involves insurance again, and it could be construed as you practicing insurance without an insurance license. Now, I know what you're thinking. You're thinking, well, chiropractors do all these things, and we've never been bothered in the past. Well, I think if you've been watching the news or haven't been living under a rock, you can see that healthcare is changing, and they are really cracking down. And as you can see, I would guess that the insurance companies don't care whether we call it an unlimited care for a fixed fee or a case basis or whatever you want to call it. They're going to look at the nuts and bolts of the thing, and they want to see what's going on. All right, so unlimited care for a fixed fee. This is very popular in our profession. Dr. Fernandez says, when a doctor offers patients a prepaid fixed monthly or yearly fee for unlimited amounts of care, he or she is practicing identically to an HMO without being licensed to do so. The doctor, therefore, is violating HMO licensing law. Stephen Conway, he is a chiropractor and an attorney. This is what he says about this. The basic problem associated with unlimited care programs is that many states consider these programs or payments a form of insurance premiums. The doctor essentially becomes a quasi-insurance company. I think this pretty much explains, hopefully this explains a little bit where this word fraud is coming in. And if an insurance company wants to come after you, they can look at you in a pretty strong sense of the word as far as if you're doing this and looking at you and saying that you're practicing as an insurance company, and that's not the way to be doing things. So what's being done? Well, I told you in the beginning what's happening. They are beefing up their auditors to come and look at us, and not just us, but doctors in general. As a matter of fact, I saw an article the other day where $330 million have already been recovered from doctors with post-payment audits. That's where this little thing here comes that says the National Association of Insurance Commissioners issued a bulletin strongly suggesting that this is an area where they're going to have an increased enforcement. All right. So to me, if I'm a insurance post-payment person coming in to visit you, this is one of the first places I'm going to look. I don't even have to get into the insurance part of it. I just have to look and see what are your cash fees and are they matching your insurance fees. Here's an article from the American Chiropractor in May 2009 where the Office of Inspector General report said 67% of chiropractic claims should have been denied. That's 2 out of every 3 claims that we are submitting should have been denied. Medicare is now tripling its auditors and launching recovering auditors across the country to review and try to recover part of the $10 billion overpaid within the Medicare system every year. Are they just after us? No, they're after all the doctors. They have found loopholes. They have found ways to come and get their money back. And trust me, they're going to try to do it. So you've got to stay legal. You've got to keep your practice legal. I know this is very negative to a lot of you right now, but there is a way out of this. I'm going to show you that in just a second. Okay, I've broken you down and I showed you how bad we all are and what bad doctors we are and everything because we've been doing it this way for the past 20 years. What is the solution? How does it work? Let's go over a few things. Here's what Texas Health Attorney Larry Lawrence says. It is permissible to offer a reduced fee to members of identifiable group so long as you provide the same fees to all the members of the group. What is he saying here? When you deal with insurance companies, you deal with many different insurance companies. You sign contracts with those insurance companies, and you agree to take care of those patients under that insurance company's rules. So all you're doing is signing contracts with each different insurance company and agreeing to pay by their rules. And as long as you do the same thing with each patient in that company, then you're doing everything right. Kathy Mills Chang again. She says this. So how can you document, bill, and code properly for maximum reimbursement when there is insurance available and still be able to help cash patients? Answer, join a cash discount program and encourage your patients to do the same. It's one of the most logical, legal, and ethical ways to allow you to accept a lower fee than your normal clinic fee. It allows you to have a contracted fee schedule for your cash and underinsured patients just like your other managed care networks. In other words, what we're saying here is that you have signed contracts with all the different insurance companies. You agree to take care of their patients at their fees. If you sign a contract with a discount plan, cash plan, you agree to see those people that are under that plan at those agreed fees. That's how it works. It's very simple. I believe that Chiropractic Lifecare of America is the answer for this problem. Now, we've been doing this for over 15 years now, so we know the ins and outs. We know what it takes. We follow the rules. We have over 5,000 different providers across the country, so we have to stay up with the rules. We are also what you call a discount medical plan organization. We are certified under that. Now, what does this mean? Well, let me give you just a short story here. A few years ago, when all this started happening, a lot of plans came out. People offer not only for just chiropractic, but for podiatry and dentistry and all these things. They started selling these plans, and what happened was there were some shysters out there, obviously, and they did some bad things, and they started charging people a whole lot of money and telling people it was insurance when basically it wasn't. Well, what happened was when the people found out it wasn't insurance, they started calling the insurance commissioner's office, and by the time the insurance commissioner got into looking into it, these people had closed up shop and moved to the next state. So the states got together, the feds got together, and they decided we need an organization to monitor this because it's out of hand. So they created this discount medical plan organization. Every plan that you have or that you might be under is, if it is not a discount plan, is not certified with the state. So that's what we have done. We have jumped the hoops, and trust me, there are a lot of hoops to jump through on this thing. We have paid the fees, paid the dues, paid the state fees, all that kind of stuff, and we are certified. There's no cost to the doctor to be a provider. There's absolutely no charge. I am not in this to make money off a doctor. I'm a doctor. I've been in practice 30 years. There's not a day goes by that I'm not asked to give somebody some money. I'm not trying to make money off of doctors. I want to keep us legal and keep us working and keep us out of jail and off the headlines. We'll do all the work for you as far as setting it up and everything. All you basically have to do is have the patient fill out the form and send it in. And the program is so simple that it takes 8 minutes to train your staff, and I'll show you how to do that in just a second. So if you become a provider for Chiropractic Lifecare, there are certain agreements that you make with us. First one is obvious, 50% off initial exams, consultations, and diagnostics, all right? That's basically your first visit. So 50% off for these new patients. Also, there's 50% off on the cost of in-house x-rays. Those are the x-rays that you take in your office, all right? Now, also, for their spinal adjustment, and that is just the spinal adjustment, not the office visit. For the spinal adjustment, you can charge up to $40, all right? And finally, you can charge up to 50% off on any other services in your office. Do you have to charge up to 50% off? No, you can leave it right, all your other services at the regular price, but you have the option to charge up to 50% off on any other services. The only thing we ask is that you keep these discounts the same for all your patients. In other words, keep everything congruent so that you don't have somebody coming in saying, why am I being charged for this, and they're getting something cheaper. So keep everything the same as far as that goes. Now, these are the advantages to patients and also, I believe, doctors. Is first of all, it's unlimited visits. So you don't have to go by the 20-visit rule and try to squeeze 20 visits into a whole year, or have patients saying, well, I can't come next week because I only have 5 visits left and I want to save them. There's no deductibles to meet. They don't have to come out and meet any huge deductibles, and that's a big problem nowadays. There's a low cost to join. We'll talk about that in just a second. There are no claim forms to fill out. You don't have all the paperwork to do. What a hassle-free environment this could become. No maximum dollar amounts. You're not limited. There's no pre-existing condition exclusions, so patients, everybody can join up. There's no enrollment exams. They don't have to pass any tests or do any physicals or anything. Everybody is included. There are no age limits for subscribers either, so age is not a factor. And this card includes the whole family. So how do you get started? It's very simple. First of all, we're going to provide you with a training CD and scripts for your staff. We've written out the scripts. We've got it so that I've been doing this myself for 15 years. We've got it down to a T. It takes about 8 minutes, as I said earlier, to train your staff. We'll provide you with all the brochures for your patients. All you got to do is let us know how many you need. We'll send them to you. You can either mail or fax them in, and you're done. Or you could have them easily. You could sign them up through the Internet, through our website also. So it's very simple to do. We'll verify all your patient records for you. If you call us and you forget when a patient signed up, or you want to check to make sure that their card is still legal, we'll help you there. We'll keep records for you. We'll also rebill your patient for you when their membership is expiring. You don't have to worry about that. We send out 3 bills to them to make sure that they re-sign up for the next year. And we also market your website on our Doctor Locator website at www.clahealthcare.com. In other words, that is our main website. We have a tab on there that says Locate a Doctor, and the patient or the client, potential patient, will go in there, put in a zip code number, and they'll pull up all the doctors in that area. Also, if you are a doctor in that area, and you have a website, we will link your website to there and also put your name up at the top so that patients see that they can go to your website and learn more about you there. It's pretty cool. There's no charge for that at all. We also market our product, Chiropractic Lifecare, to large corporations around the country. And then what they do is they add our name to their benefits card. In other words, I was speaking a little bit earlier about these cards that were out there. Well, now that there are certain laws, there are cards out there that are being sold to large corporations, affinity groups, huge conglomerations of people. And on these cards, you might have seen them on TV, they have podiatry and dentistry and prescription drugs. Well, they've added Chiropractic Lifecare, and we have been added onto over 50 different health cards, and well over 100,000 cardholders are now potential CLA patients. We also provide monthly newsletters, latest updates, practice tips, all that kind of stuff on our newsletters. We have ongoing educational classes for doctors and their staff, and we also have the CLA corporate card. The CLA corporate card is a business card, so it's all the marketing material that you need to go around and be the business chiropractor, the chiropractor for all the businesses in your area. It's a very easy setup, and it's also a whole lot cheaper for people to get involved with this. It's a great program, and we'll talk to you more about that when you become a member. It's not only for businesses, but for churches and groups and anything. So it's just a way for you to help market your practice and become the chiropractor for the whole town. We also are very engaged right now in a lot of internet marketing. So we're on over 80 different video sites. We have videos going out about Chiropractic Lifecare, talking a lot about it, pushing it, trying to get chiropractic and trying to more people, trying to get affordable chiropractic to more people. Because as of right now, as you know, things are very tight economically, and people need their health. So we're going to make it affordable for them to get their health. So how do we use this program in our office? So let's say you signed up, you filled out the paperwork that comes with this program, you send it in, you've been accepted, You now are a provider, an official provider for the CLA program. Well, it's very easy. Before you begin, all you got to do is make sure you have the brochures, which we supply to you, have them at the front desk, and that your doctor's name or your name is printed on each brochure. If you need more brochures, all you have to do is call us at this number, and we'll send out as many as you need. And we also have Spanish brochures available. So what patients are eligible? All right, very simple. If you're new or existing patients, these are both. You have new and existing patients. If they don't have insurance, or if they have an extremely high deductible that there's no way that it could possibly meet this in your office, which is becoming more and more a commonplace, or their insurance has run out, or they just don't want to use their insurance. All these patients are prime candidates for a CLA card. So what do we say to our cash patients or our uninsured patients? Easy. Mrs. Jones, this is how our cash program works. This brochure, which is our CLA brochure, explains the Lifecare card. It entitles you and your family to 50% off on all your initial x-rays and tests. You also only pay up to $40, whatever you're going to put in there, for your spinal adjustment, compared to our regular spinal adjustment charge of whatever it is, and whatever percentage off on any of the other services you want to add in this place. The cost of the card is $49.95, and really it's a fabulous deal because you'll more than likely save at least the cost of the card on your very first visit to the office. The average savings in our office for the first visit is approximately whatever it is, so it's the way to go if you want to save some money. There you have it. 4 sentences, that's all your staff has to memorize, and you fill in the blanks, and you have your whole system. Now, if you do have other things or use other things in your office, you can always say this. If you give other discounts, or Mrs. Jones, we also do this, and we also do this and this. For these, you'll also receive a 25% or a 30% or whatever it is your discount is for all our Lifecare patients. So now the patient understands a little bit about what we're doing. They come back, they see the doctor, and then the patient comes back out to the front after all the tests or whatever x-rays were needed, and at that time the patient returns. They return the application, and you just have to make sure that it's completed and everything, and you have them write a check to Chiropractic Lifecare of America. It's as simple as that. All right, the effective date will be as the day that they sign up. Okay, so they are legal as of that day. Now, here's the only other things that your CA has to learn, all right? Mrs. Jones, I just want you to know that by purchasing the CLA card today, you saved $103 or whatever their savings were over the regular charges. Once again, this card entitles your immediate family to the same benefits as you and is also good throughout the country if you are traveling and you need a chiropractor. See, you want to put those in. It's good for your family. What are we trying to do? We want to push family care. We want to get the family in. So the person says, you mean this covers my whole family too? I get these same deals then? Yes, Mrs. Jones, you sure do. All right, you charge it today or whatever they are, and you can pay that by cash or check or credit card, whichever is easy for you. Then you give them a cash receipt. That's all you have to do is give them a cash receipt. It's as simple as that. As I said, it takes 8 minutes to train your staff. It's very easy to do. All right, now, finally, the main thing you have to remember here, and this is what we're trying to do, is stay legal. We want to stay legal. The CLA card is not meant to be used in affiliation with any third-party payer, personal injury claims, workers' comp, government insurance program, or other agreements between you and the patients. Any fees paid to you as a Lifecare provider should not be used as payment for deductibles or co-payments. It is strictly for cash patients. The card may not be, or the card may be used after any other insurance reimbursement has run out. In other words, keep it separate. You don't want to mix and match. That's how doctors get in trouble. You're either insurance or you're cash. Hopefully by now you've seen what's legal and what's not legal in your practice, and hopefully you'll be willing to make some changes in order to keep your practice legal. The last thing we want to see is our brothers, our chiropractic brothers, being on the front page of newspapers. So let's just do it and make it legal. If you're not a provider, just call us. You already have information on the email. You have an attachment there with all the information that you need to fill out and send in. We'll make you a provider, send you all the materials that you need, all the training materials that you need, and all the marketing materials that we have that you can send out. If you are a provider and you have cash patients, but you're not using this card, I'd suggest that you start using this card right away. It's so simple. It's really not worth the headaches and the worry that you have to have or that you might have because you're not doing things in the right way. And if you are using the program, thanks a lot. I appreciate it, and I'm glad that you are. Thank you for attending this webinar. Hopefully it made some sense to you. Check regularly with your emails. If you are a provider, we'll send you regular email newsletters, keeping you abreast on the situations and all the different legal changes that are coming down. And call us if you have any questions at all. We'll be happy to help you in any way. We appreciate you being with us, and thank you again.